Alright, here we are in the pre-op area, about to shift this patient for yet another genioplasty. Also desires malar augmentation. So the plan is to first start with the chin, do augmentation both in the horizontal and vertical dimension for this retruded chin, and also we are going to do both bilateral malar augmentation. Procedure should take about over an hour, and everything that is going to be done inside the mouth. There are going to be no scars, so it's going to be a scarless surgery, although he will be having intraoral sutures both in the upper arch and the lower arch, and they all will be dissolvable. They are resorbable sutures, so he doesn't have to remove it. Yes, he should be good to go home again in say 5 days or 6 days. He'll be back home. Thank you. Alright, so here we are, 5th day post-operative after a genioplasty and a malar augmentation bilaterally. We have done both sides malar augmentation, little less I would say on the left and little more on the right because he had facial asymmetry. I just proceed. We've already sprayed and soaked, but this is a very painful process. I'll remove it fast. You want to remove it yourself? Yeah. Okay, I'll help you out. Many patients prefer to remove it themselves because the pain is unbearable, I guess. Don't spit. So I asked the patient not to spit because after a genioplasty there are a lot of intraoral sutures that are intact, and hang on, let me help you out. Okay. Alright, so we are done. This is the mirror. We'll just show him the post-op outcome. So his chin has been augmented. If you see, when he came to us, he had a very short lower third of the face as well as facial asymmetry. He does have a lot of swelling because on the malar region a lot of bony work has been done, also augmentation has been done. So there is going to be some amount of swelling and won't be able to appreciate results on the malar as of now. But if you see the chin, it has been augmented in the vertical dimension. His vertical height has increased. Look on at the side. So if you see, he has more of a straight chin now, whereas here there was a curvature, which you will be able to appreciate in the side view. Again, the right side was more augmented. You cannot really appreciate the results as of now because of the swelling. You see, all this is swelling, but it will come down in a period of 7 days. How was your stay here?
Great, everything is good.
Great, good. And when are you heading back?
Tomorrow morning.
Tomorrow morning. How long were you here?
It takes 1.5 days to.
No, how long were you at the hospital with us?
Since 5 days.
5 days. You had no issues? Any trouble?
I don't have any issues.
Any improvement tips that you would want to tell our?
Except lunch.
Lunch?
Yeah, it's like meals. We suffered a lot.
Meaning?
Meaning here after 8:30 we didn't get the juice and the proteins. Pantry closed. That's it.
Okay.
Other than that we don't have any.
So what he says is our pantry closes early at night. So after that he had some issues with getting the juice. So yes, there is always scope for improvement and patients should always give us feedback. But apart from that, surgery wise, post-op care, post-op nursing, all has been well taken care of, and he's been a wonderful patient. and we wish him all the best. And do send us your post-op results. Send us on the follow-up number there. Take a picture, and we will follow up and give you a final post-op outcome maybe in another 10 days or so.
Done a couple of procedures for him. First up, we did malar augmentation. We've used the foreign material. We've used silicone. I fixed it there to give him a much more stronger malar bones to reduce the nasolabial grooving. The next thing we did was genioplasty and jaw sculpting. So we've got a nice protruded chin. We've got a nice line you can see here. I'm going to show you the side view. Look at this. Now you can see the improvement. It's phenomenal. You can see. So you see that improvement, and that's all we've done with the lower jawline. Now you can see this view. Again, it looks really nice. And remember, this is still early days, just a week over after surgery. So it's going to get better. This side. Once again, you see that improvement. So yeah, we've just taken off his plaster. He's good to go now. He would come back again for a revision nose job because he said he had it done elsewhere some time back and he wants some improvement. Anyways, for this, you've got to take care for 4 more weeks. And remember, this is for life and for permanent. Here, the silicone, well, as long as it doesn't get infected, you don't mess with it, it's for life. But you have to be a little extra careful there. Even after 5 years, you will get a punch there, and if it bleeds, you make sure that, you know, nothing is going right. It'll never become part of your body. All of this is going to become part of your body. Okay. All right. Take care. I'll see you later.